Hello, good morning, everybody. This is DMA's FMGE hack session. Now we are going to talk about the pharmacology. So, speaking about the pharmacology, the very high yield area so far we have discovered was only through the antimicrobials. But the four major divisions of your pharmacology, which is very important in terms of any licensing examination, are your general, ANS, CNS, CVS, and antimicrobial. So these are the five sections where you have to stay your focus while remaining all are miscellaneous where you expect to see only one or two questions in the in those areas, like for example like autocoids and the respiratory and GIT and hematopharmacology. All those things will cover only the very few areas, which is like a 10 to 20%, while the rest of the things like general pharmacology, ANS, CNS, CVS, and antimicrobial, these five division contributes for more than 80% of the questions. So here the most very high yield area is going to be your antimicrobials. Speaking about the antimicrobials, well, so we talk about the section by section of your pharmacology. So speaking about the section by section, the first area of section we are going to talk about is your general pharmacology. Speaking about the general pharmacology, we can divide the general pharmacology into pharmacokinetics and pharmacodynamics. So speaking about the pharmacokinetics, what are the areas we have covered was route of administration, absorption, distribution, elimination, and clearance. So speaking about that, all the varieties of route of administration, and then the factors of mechanism of absorption and factors affecting absorption, and mechanism of distribution, factors affecting distribution, and clearance kinetics like a first order, zero order kinetics, and what type of drugs which follows the zero order kinetics, loading dose, maintenance dose. Everything will be covered in the pharmacokinetics, which are pretty important. You don't need to know every single topic there. And pharmacodynamics, dose response curve, and those areas are pretty important. Now speaking about the ANS, so ANS we are having a cholinergic drugs and adrenergic drugs. So what are the mechanism of action of your cholinergic agonist and cholinergic antagonist? Adrenergic agonist and adrenergic antagonist are pretty high yield area, people. For example, they may ask you the mechanism of action of your organic phosphate poisoning, which is a irreversible indirect acting cholinergic agonist by inhibiting the enzyme acetylcholine esterase irreversibly. Okay, so these type of questions, the mechanism of action are pretty important. For example, what is the drug which we uses to detect the what is the drug which we used for the diagnosis of your myasthenia gravis, that's your edrophonium. These are the type of questions that may ask you in this case of your ANS. So understanding the mechanism of action of your cholinergic agonist and antagonist and adrenergic agonist and antagonist are pretty important, people, that you should not miss each and every single thing. And a few side effects you have to remember. And a few side effects of each and everything you have to remember. That's all. And apart from that, in the case of CNS, the thing which we haven't mentioned it here, but one of the high yield areas of your CNS next to the anxiolytic is your anti-epileptics. So anti-epileptics are the choice of questions or choice of area of your FMGE. So you may ask a variety of seizures and their drug of choices and important side effects. Seizures, drug of choice, and side effects are the questions that they may ask you. So this could be number one, and this could be number two, and this could be number three. So these are the types of questions they may ask you in the anti-epileptics. For example, like what type of seizure involves the rapid blinking of eyes followed by, staring at the wall. Staring on the wall and rapid blinking of eyes is your absent seizure. Is your absent seizure. So drug of choice here is sodium valproate or ethosuximide. Okay, sodium valproate or ethosuximide. These type of questions. Drug of choice for absent seizure, drug of choice for focal seizure, drug of choice for partial seizure, drug of choice for tonic-clonic seizure, myoclonic seizure, juvenile infantile spasm, are also known as West syndrome, and all those things they may ask you, people. They may ask you here Lennox-Gastaut syndrome and status epilepticus. All of the drug of choices are pretty important, and the important side effects are very very important. For example, like a phenytoin have a gingival hyperplasia and a teratogenic effect, and some of the anti-epileptic causes Fanconi's anemia, toxic epidermal necrolysis, and Steven-Johnson syndrome are the specific and unique side effects of anti-epileptics that you have to remember in the case of your CNS areas, especially in the anti-epileptics. And speaking about the anxiolytic and hypnotics, so you should focus mainly on the action of your benzodiazepine, barbiturate, and non-benzodiazepine hypnotic. For example, zolpidem, zaleplon, and all those things. And similarly, in the case of your benzodiazepine and the mechanism of action of your benzodiazepine and barbiturate are the area of interest. Which one is increasing the duration of opening of chloride channel and which one is increasing the frequency of opening of chloride channel are the questions of choice that they may ask you in terms of your anxiolytic and hypnotics. For example, like what is the drug of choice for BZD poisoning? Flumazenil is the drug of choice. So sometimes they may ask you like, like anxiolytics. Apart from the anxiolytic, the drug of choice for their poisoning can be asked, or maybe like a non-benzodiazepine or barbiturate, like the other hypnotic agents like a zolpidem, zaleplon, and ramelteon, all those things. These type of things can also be asked in the FMGE. So anxiolytic and hypnotics are high yield area in terms of your CNS pharmacology. And then you have that antidepressant where we talk about the SSRIs and SNRIs and TCAs and MAO inhibitors. So speaking about the SSRIs and SNRIs, the SSRIs and SNRIs will maximum share the same mechanism of action, except the fact that the SSRIs will selectively inhibits the reuptake of your serotonin, while your SNRI will inhibits the reuptake of your serotonin and norepinephrine as well. So both can be both reuptake can be inhibited by your SNRIs, while only the serotonin will be inhibited by your SSRIs. So this is kind of like an antidepressant, and SSRIs is a treatment of choice or drug of choice for all type of anxiolytic disorder. So this kind of thing you have to remember. If you see SSRIs and if you see any anxiolytic, any depressive disorders or any mood disorders, then you can directly choose SSRIs, because SSRIs is a drug of choice for most of the mood disorders, like like personality disorders like obsessive compulsive behavior, and the patients with the generalized anxiety, patient with the socialized anxiety, patient with the post-traumatic stress disorder, and the patients with the like bulimia nervosa, anorexia nervosa, these type of psychiatric disorders where you need a mood stabilizers. SSRIs is always the drug of choice. So you can able to directly choose SSRIs in this area. And then you have the antipsychotics. Speaking about the antipsychotics, all type of typical and atypical antipsychotics are pretty important. Which one treats the negative symptoms? Which one treats the positive symptoms? All of them, people. All of them are pretty important. Okay, and what are the extrapyramidal symptoms? Which one is more associated with the extrapyramidal symptoms and which one is least associated with the extrapyramidal symptoms? And what type of extrapyramidal symptoms? What are the drugs which can able to treat those treat those extrapyramidal symptoms? Are again a topic of interest in terms of your antipsychotics. Okay, so with this we complete CNS, we move on to the CVS. So CVS, the main two area is your antihypertensive and antiarrhythmic and anti-anginal are the three areas you should need to focus on your CVS. Among that, the main area to focus on is your antiarrhythmic agent. So speaking about the antiarrhythmic agent, all the classes, Wagman and the Singh's class of antiarrhythmic, where they used to classify the antiarrhythmic into 5 classes. All the classes, what type of blockers is blocking all the classes, and what are the mechanism of action. Well, sometimes there will be a mixed action. What type of drugs can produce this mixed action, what will be their net result, and what type of arrhythmia are treated by what drug are pretty high yield, people, in terms of your antiarrhythmic agent. And apart from that, you have this like antihypertensive drugs. So speaking about the antihypertensive drug, the diuretics will be covered over here. Don't think like diuretics is a kidney portion. Diuretics will also be covered here. For example, like the first line of drug of your antihypertensive of choice is always the thiazide diuretic. So the thiazide diuretics mechanism of action again in turn. Next is a loop diuretic mechanism of action, and then you have this carbonic anhydrase inhibitor, and then you have this osmotic diuretics. Everything, the diuretics will be covered in the antihypertensives. So when we say antihypertensive, that includes the coverage of your diuretics too. Okay, and apart from that, the drugs acting on the RAS system like ACE inhibitors, ARBs, and renin inhibitors, and all those things, and beta blockers and calcium channel blockers, vaso and venodilators, for example, like nitric oxide and phenyl hydrazine, all of them, phenyl hydrolazine, and all of them will be taking part in this phase of your antihypertensives. And all of the antihypertensives is a broad area of your CVS. If you read the antihypertensive clearly, you can able to answer rest of the CVS questions in a very proper way. So understanding of antihypertensives is very, very important, and this is one of the very high yield area for the FMGE people. You should not miss it. Okay, and then you have the last area, chemotherapy, antimicrobial, and antineoplastic. Very, very high yield, very, very high yield. And we have in DMA classes we have made it like like a 7-page content for the antimicrobial. Entire antimicrobial was sorted out in a 7-page content, which is quite really high yield. We covered only the drug of choices and important side effects and important pharmacological aspects, like what type of CYP, cytochrome P450 enzyme, that is inhibited by what type of antimicrobial. These sort of things has been covered there. I wish you do, if you are a DMA student, you can watch that, and you can prepare accordingly. Okay, quite a very, very high yield area, people, that you should not miss. Okay, then anti-cancer drug. Speaking about the anti-cancer drug, which is focusing on the antineoplastic agent, including your alkylating and the antimetabolites and taxanes, we have to remember. So these are the main areas. Apart from that, you are going to talk about the autocoids, where you have to talk about the histamine and serotonin. And apart from the autocoids, the low yield areas like like a GIT, only peptic ulcer disease drugs, and inflammatory bowel disease drugs. You have to remember, like like what are the mechanism of action of each drug, like a PPIs, H2 receptor blockers, and like yeah, what do we call it, we have this antacids and classification of antacid, which one causes a constipation, which one causes a diarrhea, which one causes milk alkali syndrome, which one is used for traveler's diarrhea, antispasmodic, anti-emetic. This will be covered in the GIT. But technically, peptic ulcer disease drugs, you have to remember very importantly. And that autocoids, we cover the serotonin area, so we can cover the spasmodic and anti-emetic too there, like all the cetrans and the prides will be covered there. So we don't need to know specifically the anti-emetics and antidiarrheals. And apart from that, you have respiratory asthmatic drugs, like beta agonist. You have to remember corticosteroids. You have to remember, and then the low yield areas are like endocrine pharmacology. Because why we call that as endocrine pharmacology as a low yield area? Because all the diabetic medications and steroids will be covered in the medicine section. So that's why we used to call that. But if your endocrine pharmacology is so good, then your medicine part will be a piece of cake for you. So these are the other areas where you may expect to see the questions from. So with this, we are completing the pharmacology section. Thank you for watching, people. Thank you very much. We will see you with the next subject. Have a nice day.